I'm here to talk about a bill package I call the patient-centered care solution that I want to make sure that everybody understands achieves the objectives that I think we all share when it comes to health care for our citizens in the state. You know, when the Affordable Care Act, commonly known as Obamacare, was first passed, the objectives for that, or the stated objectives for that legislation, were to lower costs, to improve access to quality care, and to protect consumer choice. Well, clearly the solution that's been out there, now that we've had time to read the bill, doesn't accomplish any of those objectives. Now, in fairness, a lot of people have railed against, well, if you don't like that bill, well, why don't you propose something else? I mean, we could go off and simply play the Just Say No campaign, but I think it's a valid criticism saying, when you go off and say, if you don't like that bill, well, find something that works better to go off and achieve those objectives. And we've got a couple of different solutions that I believe are put forward to go off and address those solutions. One is offered by my good colleague from the 16th District, but the one that I'd like to talk about in context of these bills is that Patient-Centered Care Act and Senate Bills 459 and 460. I believe these are a viable alternative that actually not only achieve those objectives that were stated when we were launching the whole discussion, national debate around Obamacare, but it does so in a much better fashion and with much better care for much lower cost to our taxpayers. This patient-centered care solution has been described by David Chase out of Forbes.com as 2 parts Marcus Welby and 1 part Steve Jobs. It improves the care for our current Medicaid population, and it does so for less money. Now, I know that sounds too good to be true, but the more you investigate this, the more you'll find out that that is indeed true. It focuses on a healthcare delivery model known as direct primary care services. And direct primary care services essentially eliminates third-party billing from direct primary care service providers. Essentially, you walk in, you're covered with a regular monthly subscription, and for as low as $75 a month, a single adult in our current Medicaid expansion population can have access to a physician with unlimited physician visits, with free procedures, and with access to wholesale prescription rates on health care. That direct primary care service model would be supplemented with a high deductible health plan for catastrophic coverage. Now, for the current Medicaid population, the proposal is that we convert our existing population into a qualified health plan featuring those 2 key elements, that the direct primary care, i.e. good preventative care for those folks, and a high deductible health plan for catastrophic care. Those people would not be responsible for any deductibles in our current Medicaid population at all due to the creation of a low-income trust fund that comes from my colleague in the 16th District. That's an idea that he has in Senate Bill 422. So we're trying to blend and take the best of all the worlds that are out there. The net effect of this is that we have a solution that can lower the cost of health care for our current Medicaid population by as much as 60%, while actually providing them with better health care because they don't have the stigma of a Medicaid card. They don't have the stigma of physicians only getting 47 cents on the dollar, which they get under the current Medicaid program. They actually get a dollar for a dollar. And they get good care in the process, much better care than under current Medicaid. Now, I've been up here before talking about observations from on the national level that Medicaid really is not about care. I mean, if you're looking at true healthy outcomes, there's numerous peer-reviewed studies that demonstrate that people who are uninsured actually get better care than those who are under Medicaid. So that's one of the reasons I'm opposed to Medicaid expansion. This solution that I'm proposing gets rid of that. It gets the folks with low income access to a physician where they wouldn't necessarily have that access under our current Medicaid system. So I want to make sure people understand that not only is this an alternative, but it's a better solution for the poorest of the poor in our state and provides them with better quality care. The other thing that I want to talk about, when you start talking about lowering the cost, the overall costs associated with health care, we're not just lowering the costs associated with our current Medicaid population, we're providing that opportunity for the remainder of our population as well. And if we lower our health care costs for our employers, that means that they're going to be able to provide more of their employees with health care. Now, we've got two subs for both of these bills. For Senate Bill 459, 460, both of these subs are really just cleaning up language to address some misinformation that's been sent around to a lot of my colleagues and a lot of their constituents throughout the state.